We have Adriana and her doctor, Dr. Eva Cwynar, here with us today. Welcome to both of you.
Thank you. Thank you.
So you've been suffering for quite some time.
Yes, absolutely. Now, how were you diagnosed? Because really, perimenopause isn't diagnosed until after 40. The diagnosis of, menopause happens after 40. Before that, it's called premature ovarian failure. So tell me did your periods stop? Is that what triggered it, or just all these other symptoms?
Actually, my periods were normal, and I had
Are you
a
still
plethora.
having periods now?
Yes, I am. I still had these plethora of other symptoms. The night sweats was probably one of the first symptoms that I noticed. And then I started getting irritable. Then I started gaining the weight. And I started gaining weight.
You were having regular periods?
All during this, regular periods. Okay. And as I said, I still have regular periods.
And so how were you diagnosed with menopause? Did you diagnose her with menopause?
She wasn't diagnosed with menopause. She's diagnosed with a premenopause or perimenopause.
And let's say, ladies, explain to everyone when we talk about perimenopause versus menopause, the difference.
Well, the difference being that actually any menopause is usually going to be when the period's going to get irregular or stop. Menopause actually means when the period stops for 6 months to a year. And usually the average age of perimenopause is 45, and that's why we say anything before 40 is premature ovarian failure. But that's usually if your periods stop. So I'm sure the doctors did a workup on you to make sure there weren't any neurologic things going on or any adrenal things or other hormonal things going on. Where the endocrinologist, you're an endocrinologist, right?
Right. Her problem is what many, many women face once they actually hit their late 30s, early 40s, which is the testosterone level starts going down, so their libido gets almost eliminated. The weight gain starts, especially around the mid-abdominal area, no matter if they're exercising and eating right. The night sweats can actually start not because of a lack of estrogen, which would be more of a menopausal state, but because of a lack of progesterone. We did find that her ratio of estrogen to progesterone was not in a reproductive age. She actually had much lower progesterone levels than estrogen.
You have a 40-year-old who has a hormonal imbalance,
who
has irregular periods. Wouldn't that be perimenopausal?
No, because you don't give that diagnosis until after 40.
Well, I have to disagree. So I guess there is a difference between the endocrine world and the OBGYN world, because I actually do see the perimenopause and the lack of progesterone and the lack of testosterone in a younger woman.
So you balance that out?
We are going to balance that out.
Okay, so
and what we hope to get from this is less insomnia, no night sweating, some weight loss. We've seen that progesterone actually can make all that weight fly off of you. And we've discussed adding a little bit of testosterone for her mood. We know that testosterone replacement is a huge antidepressant in women. It converts fat into muscle, and it should give her back her libido.
And what kind of hormonal replacements do you two recommend? Because you're coming from the perspective of an OBGYN and you're an endocrinologist. For everyone who doesn't know, an endocrinologist focuses on things like hormones in our systems.
Right.
But is there a differing opinion on how you might treat versus how Lisa might treat?
I don't think so.
Well, it is hormones.
Right,
okay?
it's definitely hormones. So the easiest, simplest thing to accomplish here is putting Adriana on a birth control pill. But she's failed that in the past. She says that her breasts get really tender, she puts on weight, so that wasn't really an option for her going forward. So what we've decided to do is use just plain progesterone in the form of a bioidentical cream.
Now, let me explain what bioidenticals are, because a lot of people at home get confused by that. A lot of women think bioidentical is natural, but bioidentical means that the compound is, or the estrogen or progesterone is just similar to what's in the body. So it's similar. You have 3 different estrogens in the body: estrone, estriol, estradiol, so they're similar. Now, there are prescription medications that are FDA approved that are bioidentical. A lot of women don't know that. They think they have to go to a compounding pharmacy. The thing about compounding pharmacies is they're not FDA approved. Well, not the pharmacy, but the actual compounds, because they can't regulate the purity and the potency. So it's actually, by the Menopause Society and by the American College of Obstetrics and Gynecology and by the Endocrine Society, they really go against compounding unless you need certain strengths that you can't get in prescription, because really they can't regulate the safety of it.
Right, and that's why we're actually doing the bioidenticals for Adriana, because if you follow her blood pattern, on certain days she's going to need a little bit more cream, on certain days she's going to need a little bit less, and we still want her to maintain her menstrual cycle.
In the end, you're going to replace the hormones that she's deficient in and hope for a solution. How long might it take for her to start seeing some, hopefully,
within a month,
resolution?
Her laboratories showed that she was no longer in a reproductive age. Her FSH and LH, for those out there that understand what those...
About a lot of fancy hormones that basically regulate our ability to ovulate.
Exactly, exactly. So she's not fertile at this point.
And I really couldn't get pregnant.
Yes.
I started having problems getting pregnant at 32.
But the good news is there is hope, and we wish you the best of luck. And hopefully in the next month or so, these symptoms will start getting better. Thank you, Dr. Cwynar.
Thank you.
Our next